All right, I'm so glad to be joined once again on Bad Faith Podcast by Dr. Vinay Prasad, who is a hematologist oncologist, who is also a professor of epidemiology, to talk about the question on everybody's mind. How wrong exactly or right exactly is RFK Jr.? Thank you so much for joining me.
It's my pleasure to be here.
All right. So in preparation for this, I listened to several RFK Jr. interviews, including the one that I conducted along with my co-host, Robbie Suave, on The Hill about 2 weeks ago now, and listened to all of the sections in which he talks about his views on vaccines, not just the COVID vaccine, but also certain childhood vaccines, and the issue of whether or not there is any link between those vaccines and autism. And I have a series of specific questions about where he may be right and where he may be wrong. But I first want to start with a piece that you wrote taking on this issue independently in the Free Press, titled What RFK Jr. Gets Right and What He Gets Wrong. And I wondered if you could start with kind of like a big gloss on where you fall on this.
So thanks for having me. I think I am sympathetic to RFK Jr. on many of his sort of broader structural points about the ways in which the system is rigged against, the average American. I think he talks really passionately and eloquently about sort of corporate capture, revolving door politics at the FDA. He talks about ways in which corporate interests get ahead of American interests, ways in which people are chasing profits in the pharmaceutical industry. And on many of those topics, including some of his other topics on foreign policy, when he talks about his father, his uncle's legacy, I think he's extremely persuasive and resonant to me. When he talks about COVID-19 policy, I'm also rather much on his side about school closures, which he was a critic of, about the unintended harms of lockdown against people who are poor and impoverished, and on the COVID-19 vaccine, which I think, you've talked about before, but has maybe certain unique aspects to it. Now, he also says a lot of things about traditional childhood immunization, including the measles, mumps, rubella vaccine, tetanus, diphtheria, and pertussis, inactivated polio. I think those claims are not only incorrect, but I do agree with some of his critics that they are dangerous, that the more he says those things without sort of certainty, and also oftentimes being incorrect, he will actually further push people away from those vaccines, and that will have consequences for everybody. So for me, he's a fascinating figure because on the one hand, I like so much of what he's saying. To me, it's refreshing to hear a Democratic politician say that. And on the other hand, he says a few things that have substantive importance in biomedicine that I really disagree with. So we can get into it.
So, okay, let's start there with the measles, mumps, the childhood immunizations, basically. Something that he often says is that there are 14 studies that disprove the link between autism and those vaccines. And he often offers to his guests, we can go through them study by study, and I'll explain to you why you shouldn't credit them very much. And I wonder what you make of that. What are these? Would you have a sense of what these 14 studies are? And what is the evidence that we have that disproves the link or suggests that we're very far from proving, substantiating any actual link between those childhood vaccines and autism?
Okay, so I guess I would say that for me, the strongest single paper, of course, there are many papers here, and then maybe we'll want to talk a little bit about what it means to create links and prove links. But so I think that's sort of a broader question. But okay, let's talk about what I think is the strongest study by Anders Hivid in the Annals of Internal Medicine called Measles, Mumps, Rubella Vaccination and Autism, a Nationwide Cohort Study. It's from Denmark. It runs from 1999 to 2010. And the conclusion is this study strongly supports that the MMR vaccination does not increase the risk for autism, does not trigger autism in susceptible children, and it's not associated with clustering of autism after vaccination. It adds to previous studies with significant statistical power and addressing the hypothesis of subgroups and clustering of cases. So what does that mean? There are lots of studies here, and I think we have to understand where RFK is coming from. So I tried to do that in my piece. He's an environmental lawyer. And when you're in the environmental law business, I think you just need to create the appearance that some toxin is linked to some health problem. That's the threshold that they use in the law. I think it's fundamentally a different threshold than we use in medicine. In medicine, I think we want to be substantively sure that some medical product is linked to a condition that people worry about before we go and tell them that it's linked. and potentially lose the benefits of the medical product. So let's be clear, the MMR vaccine offers tremendous benefits. It offers benefits both to the individual who receives the product and also the benefit that when a certain fraction of the population receives it, you can actually extinguish the measles epidemic. It's different than the COVID vaccine, okay? So I think he's got a point there. And some of his critics have tried to lump all the vaccines together to their detriment, I think. But he raises this question of whether or not it's linked to autism. I think this is probably one of the strongest studies on the topic. I think if you look at all of the studies on the topic, there are many studies that show there's no link. I'm sure he can find some studies that show there is a link. That's just the nature of science that, some studies will. But the problem with this is, some of the problems in the studies that he cites are they don't adjust for all the other factors that might go into an autism diagnosis, like the factors in the parents who choose to get it or those who don't, and they may have a smaller sample size. And the other challenge in medicine, which is that if you take any idea and you run it in 100 or 1,000 data sets, some of those data sets will find erroneous or false positive associations. So I'm generally not sympathetic to his view that he has proven that there's a link there. But I am sympathetic to some of his broader views about how should we take medical product safety seriously, and maybe should we be more vigilant about vaccines in general. So I'm sympathetic to him on that. Yeah.
If I can just, I gotta devil's advocate this a little bit.
Sure.
One of the claims that I've heard raised repeatedly is that the studies don't track what happens when there is the aggregation of multiple childhood vaccines. And the argument is that in the 80s in particular, the number of vaccines that were recommended to children grew at a significant rate. And they were clustered very close together in time. And so the argument some people make is not that one particular vaccine has the causal effect, but that the inundation of a baby's body with these vaccines all at once without spreading them out at all was unprecedented and has effects that haven't been closely tracked. Are there studies that look at specifically the aggregation and timing of vaccines in that way?
I guess I would say that, has anyone proven that that claim is true? In my opinion, the answer is no. Like, they haven't proven that the aggregate, right? Okay, but has anyone proven that is impossible to be the case? No. And actually, I guess I'm a centrist on this, so I would concede to him that I think one thing that a government could do that would be very interesting is what we call factorial randomized control trial, where you actually come up with 4 or 5 or 6 different immunization schedules around children, slightly different, maybe on different timing, different doses, maybe the ability for parents to, change something in one arm or the other, and then run a very large study. And so I guess, let me put it another way. There are people on the pro-vaccine side of the spectrum that says, if you even concede to the point of view that I've offered, like we should do another study, you are giving in to this kind of anti-vaccine view. I disagree with those people. I actually think at some point, medical science has to address the real fears and concerns people have, even if many of us think that they are unjustified to have those fears and concerns. We have to address the public where they are. And so I'm actually surprisingly willing to concede to him, yes, I'm open to a multi-arm randomized control trial of different vaccine schedules, knowing that this particular schedule is to some degree arbitrary. I don't think anyone will say that, we've tested every permutation and this is the best one. It's arbitrary. Is there another way to do it that might be superior and get more adherence or at least reassure the public that there is no untoward safety signal? So I guess I'm open to that study. But in the absence of that study, I guess this is the thing I come to. I was telling this to a colleague recently. What if I were to tell you that the shampoo Selsun Blue is linked to gout? Okay. You're going to say, well, why are you picking Selsun Blue? Why are you not picking, Head and Shoulders? Why aren't you picking Dove? Why are you picking one shampoo and saying it's linked to gout? And the truth is, as a scientist, no scientist can say absolutely 100% it's not linked to gout. And even if you do a very large study, it's still possible that it's linked in a very, very tiny way. But the flip side of the coin is, well, why do people even believe that in the first place? What's the rationale for that? And I think in the case of vaccines, the reality is that for many people, it's the classic logical fallacy, post hoc ergo propter hoc, which is like, it happened after this, therefore it was due to this. But of course, lots of children are getting immunized. And of course, autism is typically not a diagnosis made the minute the child is born. So of course, it's natural that many people will feel like that diagnosis happened after the vaccination or that the kid was doing fine and then it happened. And so I guess I am sympathetic to parents and mothers who feel like they're linked. But that to me is not enough to persuade me that it is linked.
So I guess the argument, so basically what you're saying, and many people have said this, that correlation is not causation. The fact of the matter is that autism tends to present around the time of kids' vaccination schedules. And so there does seem to be there's an appearance of a link, even if there's not a causal link. But I would also say the flip side of that is that the argument is it's not just randomly choosing Selsun Blue off the shelf. It's saying that we know that the preservatives that historically have been used in vaccines, previously mercury, that was taken out partly because of the pushback from parents. And now aluminum has come under focus by people like RFK Jr. Some folks say that's moving the goalpost. Some people think it's a fair critique, but whatever. No one disputes that those elements are toxic in a given amount, right? The argument for people who are using them as preservatives in vaccines is that in the small doses that exist in the actual vaccines, they are not a problem. And there have been a number of studies that seek to demonstrate this by testing the levels of those elements that are in the blood supply and in the brain after vaccination in kids that present with autism and kids that don't present with autism. Okay. So this isn't randomly saying, I think my shampoo is a problem. It's saying, well, we know that we're putting a toxic material in the bloodstream. And if we can demonstrate that the accumulation of all of these toxins because of the sheer volume of vaccines actually is higher than any one vaccine that was approved delivers, then there's a potential basis. There's at least enough here for us to look more closely at whether or not there is a causal relationship here as well. So what do you say to that? And what evidence do we have from a research perspective, from a science perspective, about there's one study in particular that he points to, which studies the amount of mercury and aluminum that managed to surpass the blood-brain barrier.
I guess the only thing I would say to that is, I mean, it sounds like you're saying, is there prima facie a case to take seriously the question that there could be a link?
Well, no, that some people have identified this as a potential issue. So folks say mercury doesn't pass the blood-brain barrier, and RFK Jr. cites a study that shows that they're obviously not killing kids to test their brains, right? So there's a monkey study that he frequently raises that says, well, when we did kill monkeys, because you're allowed to do that in some conditions, I guess, we did measure troubling amounts of, I believe it was mercury in their brains. And he's pretty careful not to say this is conclusively showing X, Y, or Z, but he does say this merits further study, right? So, I mean, what do you make of that? Has there been further study? Are there studies that he's ignoring? Is that a cause for concern?
I guess the answer is, to some degree, I mean, as a scientist, you can always say, yes, there should be further studies. I mean, that's always the case. I mean, I'm not opposed to further studies. The second thing I would say is that the better studies would directly try to link the receipt of the vaccine to autism in the population level through sort of like that study that I cited in the Annals of Internal Medicine. I think that would be a better type of study. I mean, I think what the type of study you're talking about is like the bioplausibility study. He's trying to create the appearance that it may be bioplausible, like that there is some plausibility that it could be linked. I think there are many other people who think that it's very implausible at those doses, right? And so there's other studies that may show that it's implausible. But ultimately, the better study is a surveillance study of the population to see, is it in fact linked? And I guess when you look at those, which I have to some degree, but I guess I'm not persuaded that there is a link. Now, the part that I'll concede to him is that I think, and this is the unfair part of a debate with pure scientist and RFK Jr., which is that no scientist can ever tell you that something is not linked with 100% certainty, right, especially if the link is like a ratio of 1.001, like a very small link. We can never say it's not linked at such a small level. What we can do is exclude bigger links that we think would be impactful at a population level. The final thing I'd say to him is, overall, I am his biggest supporter on the question of, for all medical products, do we need a better system in place to look for safety signals in a regulatory environment where nobody who's making money from these products wants to find that? I'm not just talking about vaccines. I'm talking about pills, drugs that millions of people are taking. Our system, our phase 4 regulatory system, is very, very bad. And so the thing I would say to RFK is, I would always ask him, what is your policy? I heard him on Barry Weiss's podcast. She asked him, I know you have these concerns, but one, what do you tell a pregnant woman? Or what do you tell a mother? And then what is your policy? And what he said about telling a mother is he said, ask your pediatrician and do your own research, which I actually, it's hard to argue with that. The second thing he said.
Sorry, go ahead.
Yeah.
I don't mean to interrupt.
No. And then the second thing he said is, what's your policy? He didn't get into it as much as I would have liked him. But I think there's a way to say my policy should be, we need a impartial third party monitoring the safety of all medical products. We need a certain amount of testing that we're going to all agree. I have my thoughts on how that process would look like. And I think we need the public to feel like that agency is not captured by the corporations.
Yeah.
And honestly, I think he's right about that, because I can smell the way the wind is blowing. And this problem, distrust in medicine, is going to grow in the next 10 years, in my opinion. So I think we're better off by capitulating a little bit to him and creating that system and seeing what happens. Yeah.
Yeah, I mean, so part of what's happening here, and this has some interesting echoes with the conversation we had before about COVID and the risks of vaccine and myocarditis versus the protective effect of COVID and doing those kinds of balancing tests, is that so earlier you compared his mindset coming from a kind of a toxic tort law, environmental law perspective versus a doctor's standard of proven causality. I don't know that I entirely agree with the differences there. Companies don't want to pay, and the law is written to make it so that they mostly don't have to. And you very much do have to prove causation in a way that's not rigorous in a legal context, not just correlation. I mean, we've all seen Aaron Brockovich. It's a pretty high standard, and it's very difficult for plaintiffs to win. It's very costly, and because people just do get cancer and do get sick, generally speaking, from all kinds of environmental and hereditary reasons, it can be a real challenge. But I think a real difference between the vaccine example and the kind of toxic tort example is that in the vaccine example, we're weighing it against the benefits. Where in the toxic tort example, toxins are bad. Nobody wants this in our environment. Okay. So there is an added bar because you have to prove that the costs outweigh the benefits. Now, one way that he goes about doing that, and one argument that he makes, is from this study, McKinley McKinley. I don't know if you're familiar with it, but it's a study from the 1970s where these scientists argue that there's evidence that the decline in deaths from infectious diseases bottomed out before there was this huge increase in healthcare spending on mass vaccination campaigns, et cetera. And they argue that that's the case for these 11 major kinds of infectious diseases. And for the 5 others where there was a statistically significant impact of the kind of vaccination protocol on the incidence rate, the death rate from those vaccines, it was only a 3.5% decline. And that the decline in deaths from any number of the diseases, common infectious diseases that we're talking about here, are because of improvements in the standard of living, diet, hygiene, antibiotics, and the like. So obviously, if the argument is, well, the vaccines aren't even doing that much to save lives anyway, then the openness of the discussion, the extent that you have to prove that they are not, if they're less helpful, then you don't have to prove that they're harmful, right? To basically make people get into his position where they're saying, well, maybe I won't take them at all. So what do you say about that McKinley and McKinley study?
My read of it is basically, this is an older study that's tracking death by different causes of disease. So one caveat, of course, is to know that back in the diggity, people weren't always very good at ascribing the cause of death. So I think that's always a limitation of these studies. But nonetheless, I think this shows rather dramatically that there has been a huge reduction in death from scarlet fever and measles and typhoid and tuberculosis. And what the authors wish to do, and influenza and whooping cough and poliomyelitis and pneumonia and diphtheria, infectious disease causes. And what the authors wish to suggest is that the bulk of this decline happened prior to the widespread vaccination campaigns and is likely attributable to better sanitation, working conditions, et cetera, et cetera. And I guess I would say, as somebody in public health, that I'm pretty sympathetic to that view, that sanitation and public health and improved socioeconomic status actually does significantly lower the death rates of these conditions, these lamentable infectious diseases. Now, I think the challenge of the paper is, of course, that after the debut of the vaccine, the toxoid or the antibiotic, there is a continued, in many cases, from me looking at the curves, a continued decline in the rate of these death from this illness. And if even some of that is attributable to the vaccine, that's going to be quite important at a population level. And so I guess and ultimately, I think when you're talking about studies in the 1970s, they're going to be doing a very, very poor job of causality. I've always made the joke that only in the world of COVID-19 politics can you put an arrow on a line and say that caused that, because there's lots of other trends going on. And so, in epidemiology, we like to do much more rigorous causal analyses. But if somebody wants to argue that we have seen real declines in these infectious diseases prior to the advent of vaccination, I think this paper does support that. But what it doesn't support is that vaccination does nothing for these diseases, which is really what they need to get you to that point, that it does nothing, right, before you start. And then just back to your original point, I mean, I think you make a very valid point. And as an environmentalist, which I consider myself to be, I think the threshold to put pollutants in streams has got to be very stringent. Like, we should not let corporations put pollutants in streams, even if there's market ambiguity about the health effect of those pollutants. Because why do I want to pollute in the stream anyway? Now, when you talk about vaccination, of course, even if, lots of the measles went away before, there were still outbreaks of measles, and it's, not a great disease to get. Mm-hmm. And vaccination campaigns, I do think, prevent the spread of the measles. And so there is some public health benefit. Contrast that with the suggestion of harm, which I think is, in my mind, not conclusive. But putting all this together, and again, I am really a centrist on this issue. I don't think I'm where a lot of public health people are, who are, I think, extreme defenders of vaccines. I'm willing to agree to many studies to further provide evidence as to which, when, provide a net benefit and are worth pursuing, and which maybe we can put on the back burner, and maybe we can sort of have some compromise with the American people. My biggest worry is that it's going to be a binary choice, either every vaccine or no vaccine. And that's my worry. Yeah.
But my worry is that, frankly, shutting down this conversation is what forces people into a binary choice.
Yes.
Like, I was reading some people who are arguing that something like a hepatitis B vaccine, where it's much more likely to be an exposure issue, or you're traveling a certain kind of part of the world, engaging in certain more high-risk behaviors, et cetera, is maybe something that you don't give at a young age, that you space out, that you wait. That doesn't seem to be an irrational thing as compared to some of these other kind of common childhood vaccines, where we have seen outbreaks in places like California, where there has been a kind of popular anti-vaccine Jenny McCarthy style of sentiment. Like, we don't have to imagine. We've seen outbreaks happen in communities where there are low vaccination rates for some of these childhood diseases. But, I have heard women in my own life and in my own family tell me, who are educated women who were in early childhood research doctoral programs when they had their kids, who tried to raise this subject with their gynecologist in the 80s, and who were shut down so harshly that it made them, frankly, more skeptical and more frustrated and more distrustful of medicine. So, I mean, that's part of why this is so useful. Because to be honest with you, when I Googled the McKinley McKinley study, I thought I was going to get a million hits of, this is crazy, this is wrong. And then I said, well, let me put McKinley plus RFK Jr. Because certainly, since the whole corporate media wants to undermine this guy, they will all have done this work to show why all of the cases that he's citing routinely over and over again are wrong. But I didn't see that. I just see he's a vaccine denier, he's a anti-vaxxer, da-da-da. And like, if he is wrong about this stuff, this would be the easiest way to scuttle his premise. And it is increasingly problematic, or I shouldn't say problematic, but it is increasingly unnerving to me that as I dig, I'm not getting as clear clearly discrediting evidence as his detractors might suggest exists.
So that is well articulated. I think, for the sake of devil's advocacy, let me read you what Paul Offit wrote about the Hep B vaccine in his blog.
Sure.
And then I'll tell you what some infectious disease doctor told me privately. RFK says, quote, "You get hepatitis B from sharing needles, going to a really seasoned prostitute, from compulsive homosexual behavior. A baby gets it from their mom," end quote. And he also mentioned that now we test the mother, so maybe we don't need to give it right away. Paul Offit writes, "Before the hepatitis B vaccine was recommended for babies in the early 1990s, the virus infected 18,000 children a year. Half of those did get it from their mother. So to RFK's point, I think that if you screen the mother, then maybe you'd avert those in the absence of vaccination. But he says the other half from non-sexual contact with someone who is silently infected with the virus, the Hep B virus has virtually eliminated Hep B infections in children. And of course, Hep B, I think, is much more prevalent in places like China from acquisition at birth. Now, where do I fall on this question? I think, so even Paul Offit would concede that half of it has been mitigated by testing the mother. So we have half of it to deal with. Paul Offit thinks that it's still worth it to prevent that half. I had an infectious disease doctor who I will not name, but he texted me saying that he's open to considering whether or not the Hep B vaccine should be given only in people at particular high risk. Like there's a little bit of a discussion to be had. So, these are two different experts with two different points of view. Now, to your point, I think it is very bad for public health to say the conversation should not be had. And I suspect, as I always suspect when doctors try to silence patients, the reality is that the average doctor administering these things has not spent all this time reading these things and also is not really trained to read these papers. I mean, it's a particular skill set.
That's terrifying. That's kind of terrifying.
It's terrifying.
Because there are parents, there are mothers who do take the time because it's their children and their own lives that are implicated. People, like the women in my family that I spoke to, who then felt very dismissed when there was not, perhaps because they were defensive and insecure about not being as read up on the subject as their patients, but that dismissiveness bred distrust.
Yes, and let me read you the quote from this infectious disease expert. Quote, agree about hepatitis B regarding the questionable need for universal coverage, although I generally don't see a major downside, end quote. So that's what he says. So, but I mean, that's very different than I think the way people are treated. So to your point, which is that I think it's no longer going to be tenable to not have the conversation. And, my view is it's no longer tenable not to debate RFK Jr. I think the only solution is we agree on some going forward safety system where even RFK Jr. says, if this finds a signal, I'll agree. And if it doesn't, I will let this go.
Well, let's go to that downside point, because I'm telling you, RFK Jr., say what you want, but he's a lawyer. And there's a certain logic that he creates in this narrative where he anticipates some of this stuff. So one of the arguments that he makes is that these so-called rare injuries that, what's the downside? Well, that there's a bigger downside than people are letting on. And he cites this 2010 Lazarus study, which was an effort to kind of assess, as I understand it, the kind of reporting mechanisms for vaccine injury. And what they found was that there was an injury rate of 2.3%. He said 2.3%. When I Googled it, it was actually 2.6%, which was about 1 in 37 people for all vaccines. Like, this was not a vaccine specific study. And that there was some indication, according to the Lazarus study, that these were underreported because people don't really have a good sense of why they're feeling the way they're feeling and if it's attributable to the vaccine. And that this is self-reported, and it's not necessarily that there are significant injuries here, but that the vaccine reporting, the vaccine injury reporting mechanisms that have been set up at hospitals indicate that the risks might be higher than we have otherwise assessed. Does that give you any pause? What do you say to folks who might wave around the Lazarus study?
And I'm reading it right now. So this is by the AHRQ, which is the Agency of Healthcare Quality Research, is by Ross Lazarus, and it's called Electronic Support for Public Health Vaccine Adverse Reporting System. This is the study you're talking about, 2010 study. So, I mean, look, his point is well taken, in my opinion. And in many ways, one, I'll give you two more recent examples, which is that although we in the United States kept telling people we have the best surveillance system in the world, in two important ways, we proved that we didn't. Both the vaccine-induced thrombocytopenia and thrombosis, which was linked to the adenoviral vector vaccines Johnson & Johnson and AstraZeneca, that signal was detected in Europe. They gave a lot more AZ there. They saw the signal first. The signal of myocarditis in healthy young men was detected in the Jerusalem by the Israelis in the Jerusalem Post in February. I think there's a quote from Rochelle Walensky in Reuters where he said, we've looked at 100 million cases and I haven't seen the signal, end quote, something like that. We can pull that quote. She said that many months later, when the European EMA said it was a real signal, and then ultimately we conceded. So to RFK's point in a few dimensions, one, I agree we have indemnified the manufacturers, meaning they cannot be litigated for vaccine injury. I disagree with that. They should be able to be litigated. In America, I think you should be able to be litigated for any medical product I agree with him. It creates perverse incentives in the marketplace. So I think we should allow litigation. The second thing I'd say is this surveillance system the gold standard surveillance system? Absolutely not. And so everybody who opposes him, even people who are pro-vaccines, should be able to say, we need a better surveillance system. We miss some of these signals in the US because in order to report to VAERS, you have to have the idea in the back of your head that the myocarditis was linked to the vaccine. If that idea is not in your head, you may not even report the case. Mm-hmm. And so we have other systems like, the vaccine safety data link system that do try to do a better job there, but I think they're still inadequate. So I agree with him. If his solution is we need a much better safety system run by a non-conflicted agency with a ban on revolving door politics, he's got my vote. I mean, I agree to that. No doubt about it.
Yeah. So you mentioned this, so we should just get into this really quickly. This idea that the vaccine manufacturers are constructively indemnified against liability for any adverse effects from vaccines. So he references this 1986 statute, the National Childhood Vaccine Injury Act, which creates a fund, an excise tax for every vaccine sold that goes into a pot for no-fault compensation. So if you believe your vaccine injured, you bring a claim specifically to get recouped from this pot of money if you qualify, but you aren't allowed to actually sue the companies directly. There are some narrow exceptions. If there was fraud or intentional withholding of information, or if the vaccine manufacturer failed to exercise due care. But the idea was that because there was something called, quote, the vaccines were unavoidably unsafe. There was always this risk factor built in. And because of the public health benefit of vaccines, that you had to protect the vaccine manufacturers, or otherwise they wouldn't produce the things that are causing all of these great benefits that, of course, RFK Jr. would dispute. But let's just, for the sake of argument. So RFK Jr. says they convinced the Reagan administration that vaccines were unavoidably unsafe and that therefore manufacturers couldn't be liable, at the same time that they were absolutely necessary for the public health. And this has created an incredibly bad incentive here. And so, I mean, I guess I would put to you, one, are vaccines actually unavoidably unsafe? And is that a weird sort of admission? Or do you think that the Liability Shield has basically created a perverse incentive not to try to make vaccines safer? Potentially, for example, the choice to take mercury out of vaccines, whether or not, I mean, there was never a demonstrated connection to autism, but ultimately because of public pressure, there was a choice made to take them out of the vaccines, which to some people is a sort of an admission.
It's a very good question. I mean, but you're talking to somebody who disagrees that they should have this legal protection.
Yeah.
I really do disagree that they should have the legal protection. And I'll give you one specific example that happened in the last few years. So I think people will be more sympathetic to my point of view, especially a lot of doctors who I think probably not sympathetic to my point of view. But it's the fact that many colleges around this country have forced a college student, a 20-year-old man who had COVID, documented proof they had COVID, to receive additional booster after booster. Some of those college students, maybe 1 in 10,000, will have myocarditis. Neither the college can be sued nor the manufacturer can be sued. That to me is an unusual precedent in American law where you're not culpable for your actions then. So can you mandate them to have, you can just keep mandating whatever you want. You have no skin in the game. You pay no price from your mandates. We have had like daycares and summer camps have their own vaccine mandates that go beyond what even the CDC wanted people to do. So we're getting like, the amateur administrator playing public health expert in their local daycare or summer camp. That to me is untenable. And so, yes, I think they should be able to be sued. I think it will make them think twice about their mandates and have better data for what they want to do. Now, to your point, the moment you prevent litigation, I think that, an economist would say it theoretically makes sense that you would err on the side of having a little bit more safety signal than you would otherwise. Like if you really had to pay the price in litigation, you would do maybe more R&D and try to cut back on safety signal. I mean, I think that's a theoretical argument. The thing I'd point out is that I have not seen empirical data that that's true or not, but it is plausible. And ultimately, I would strip them. I mean, this is something that I think he's right about. I would strip them of that legal protection. We also have drugs like Ozempic. Ozempic is going to be taken by 100 million people, maybe. I don't know. A lot of million people are already taking it.
Oh, are that many of us going to actually be able to get our hands on it?
Yeah, eventually they'll find a way to make it. I mean, I think if there's money, they're going to make it. But my point about Ozempic is Ozempic will be subject to much litigation. It doesn't have this protection. People will say Ozempic caused them to, I don't know, everything from lose their car keys to lose their hair to have dementia. And then the courts will have to decide which of these are real signals and which are not. But to RFK's point, I think it's a mistake to take away the ability for the public to seek compensation in the court of law. I think that to me is a little bit on.
Do you think there is a real risk, though, that some of these companies could be put out of business if they really were subject to have to pay for vaccine injuries?
I guess I would say anytime you talk about any drug regulation, there's always a tension between the more money you give them and the less risk they take, the more products they will make. I mean, this is true in any domain. So if you make a new fund that says a lottery, anybody who makes a new vaccine, we're going to give $100 billion federal, just a single gift, you're going to incentivize that behavior. But the question, of course, is, where is the sweet spot on this curve of incentive? Is this too much incentive? So to your point, will some vaccine makers not make vaccines? I'm sure that's the case. The less risk and the more reward, more people will do it. And the more risk and less reward, less people will do it. But the question is, where are we on the sweet spot? Is this necessary? Is this particular legal protection necessary?
So this is in the same vicinity of claims from RFK Jr. So he argues that vaccines are unique among drugs because every other type of medicine requires placebo-controlled trials except for vaccines.
On the side that shows that autism is caused by vaccines, there's over 100 studies. I, in fact, did a book in which I listed all of those studies and digested them, in other words, summarized them all, and you can go and source them. And I have over 450 450 studies summarized, and I have 1,400 citations. Okay. Every medicine is required to do placebo-controlled trials. That's what science is. You give a group of people, a cohort of people, the medicine, and then you give a similarly situated cohort of people the placebo. And then you look at health outcomes over a 4 or 5 year period, because many of the impact of the outcomes are going to have long diagnostic horizons and long incubation periods, so you won't see them immediately. You need to do it. Anthony Fauci has said 8 years for a vaccine. You need to watch them for a while. Those studies have the only medicine that never gets tested are vaccines, and that is what I object to. It's not. I'm not saying that.
Not only the only one
effective. All I'm saying is let's test them the way that we test other medications. That does not seem unreasonable.
That is not unreasonable.
Well, that's my position.
Now, quick Google suggested to me that seemed obviously false, that there were placebo-controlled trials for vaccines. But what is the truth about that? Are vaccines being treated differently than other kinds of medication in a way that would increase the risks of vaccines as compared to other types of medication?
Okay, so to be fair to RFK, what I think he is saying is the following, which is that there have been many vaccine studies where you randomize people to the vaccine you're interested in, and the control arm is either a different vaccine, like not a saltwater injection, or the vaccine without the active ingredient, but maybe with some of the preservative or some of the adjuvant. Okay.
And the preservative is the problem, allegedly, with these vaccines. It is the mercury or the aluminum or whatever that is the preservative.
Well, that's what he thinks. I think there's no problem for most of it, but okay, but that's what he thinks. So, but I mean, so if you have his worldview that's the problem, and the control arm is not getting, I think what he means is the control arm is not getting pure salt water. Now, I want to point out that at least in one trial, to my knowledge, in the Gardasil studies, there was a control arm that did get pure salt water. Now, Now, I had somebody from the pharmaceutical company we were texting earlier, and then this person writes, quote, "What is a proper placebo is not an easy question. Saline, the vehicle and not saline, perhaps a solvent or additive, the vehicle and some other things. Each has pluses and minuses. There's no perfect placebo." So let me unpack that a little bit. So if you use salt water versus your vaccine, the plus is that any fever, headache, nausea, you're going to find more of that because the control arm should not cause any fevers or headaches. It's salt water for, absolutely. So you'll be better at picking up the safety. The downside is, maybe people will kind of get the feeling like I'm not getting anything, and they maybe behave differently, et cetera. Like you may have some unblinding going on. So maybe if you have an adjuvant and they get a little fever too, then maybe they'll think they got something and their behavior will be the same. You know what I mean? So
I see.
So that will sort of control better for the efficacy question. So I think to RFK's point, look, I concede to him that if what he's saying is they didn't all have saltwater control arms, true. And if what he's saying is that means you can't take the package safety comparison, with at face value, it may increase more fevers, et cetera. True. But the flip side is that doesn't prove his case that it's linked to autism. It doesn't prove that case.
Right. But it does disprove the counter argument, which everyone brings up to him, which is that there have been however many dozens of studies or 14 studies, whatever they are, that have looked for a link and found none. If in all of those studies, they're still injecting people with whatever the preservative is that he thinks is the causal agent.
Oh, okay. Well, let me come back to that. So I think some of the studies that find no link, the group of kids that didn't get the vaccine literally got nothing. It's an observational study. Okay, it's kids who literally got nothing. So it's not kids who got the salt water. Mm-hmm. The randomized trials agenda that he's talking about is much smaller than the totality of the observational studies that don't show a link. So in some of these studies, it's really people got the vaccine for people who literally didn't get anything. Okay, so that's one point. But the second point is, I actually do see he has a point, which is that, if you really want to know the safety profile of something, the control arm should be salt water in a randomized study. Okay, so the compromise I'll meet him on is, if he can identify some vaccines he thinks that would be very interesting in, I'm perfectly comfortable having FDA compel the manufacturer to run a saltwater placebo-controlled trial. And maybe going forward, might be nice to have 3 arms of the study, like a saltwater placebo, a placebo with just the adjuvant in, and then the active vaccine, so that you can get a sense of, how much is the difference between the 3 arms. So, I'm sympathetic to that. I don't think it proves his case. That's why,
Right. Right. But if we can live in we need more testing gray area and not feel like it's going to lead to mass rejection of childhood vaccination, which is a big if, but if we can just kind of live in that zone, I think what RFK Jr. would say, if I'm mooting his argument here, is that he says, I'm not anti-vax. I'm vaccinated. My children are vaccinated. I'm not anti-vax, he says. Right. I'm simply pointing to the fact that there is not as much conclusive evidence that there isn't an issue here as perhaps there should be, and that we need to do more studies, and the studies that have been offered as proof that there isn't a problem here don't prove that. It's just still it's a possibility zone. Maybe a not probable zone, but a possible zone.
Yes. So I guess for 18 years, people have taken the tactic against him that anything he says is crazy and he's a lunatic and he's a quack and he's a whatever they call him. We'll never platform him. We'll never let him be on any show. In the last 3 weeks, he's been on every show. He's been everywhere. And people hear from him directly, and he comes across as rather reasonable. Mm-hmm. I have always disagreed with the tactic that he should be excommunicated and treated as a pariah. I don't think that's helpful. Going forward, I think it's absolutely not helpful. I think the only way to, I don't even want to say rebut, the only way to effectively address his concerns is to sit down with him, talk to him, and agree on some compromises that we all think are palatable. And having said that, I would bet money, my own money, that some of these vaccines are not linked, I will bet money the MMR vaccine is not linked if you do the perfect study. Now, The things he points out are, I think, deficiencies in drug regulation could be better. And I think the people on the pro-science side, which I put myself on, we need to acknowledge that, the systems that were developed in the 60s, 70s, and 80s, they may not be fit for purpose in 2023. Like, we could do better studies, bigger sample size. As a tangent, I personally thought that some of the COVID vaccine studies in young children were, many of the things RFK might have said would have been true. The sample size is too small. You're not measuring the thing people care about. You're measuring antibody titers and not actually whether or not the kids got COVID or whether or not they get very sick. And the company's got all this money. Why can't they just run a bigger study? And why can't we have better safety and follow them a little bit longer? So those are the kinds of things I'd imagine he'd say. And I think, that's right. Like, we could have done better studies there. The company made $100 billion. So I do think the only way to, I think the way you're handling it, this is the best way. It's the only way to give credit where he has some points.
So, you bring up COVID, and that was kind of where I wanted to go next. He mentioned this in his interview with me on Rising and elsewhere, this Cleveland Clinic study, which we've also covered extensively on Rising.
The Cleveland Clinic study just came out, a new version of the study yesterday that shows that the more vaccines that you got, the more likely you are to get COVID. This is what the science is saying. That's 56,000 employees of Cleveland Clinic, a major, large study is showing the vaccine not only doesn't work, but it works opposite of what we were told that it was going to work. We should have focused on the therapeutic remedies that actually work. It's things like Zithromax, hydroxychloroquine, ivermectin. The countries that use those had much better records. Our protocol gave us the worst body count from COVID on Earth. So doing everything that our government told us to do, we racked up 16% of the COVID deaths globally. We only have 4.2% of the population. The countries that used ivermectin, hydroxychloroquine, countries like Nigeria, didn't even have a pandemic. We were told they were going to suffer terribly because of their poverty. Instead, they had a death rate 1/200th of the death rate we had in this country. And you can look across the globe. The countries that adopted our protocols did the worst in terms of COVID deaths, COVID mortalities. The countries that did the opposite, that employed ivermectin, employed hydroxychloroquine. Nigeria had a 1.3% vaccination rate, and it had 14 deaths per million population. We had 3,000 deaths per million population. And of course,
and his argument is that according to that Cleveland Clinic study that measured, I forget how many, but a good number of employees at the Cleveland Clinic, one of the best hospitals in America, that the vaccine is effective at preventing transmission for about 2 months, that it's like broadly effective for 2 months. And then that wanes to the point of negative efficacy at around 7 months, such that you are more likely to get COVID at that point by a factor of 3.5%. That seems to be what the Cleveland Clinic study says. Is there some reason? No, that's not an argument against not getting vaccinated. It still has a protective effect for hospitalization and death, right? But given some of the arguments you've made about the protective effect of having had COVID, and when you compare that to this negative efficacy, there is potentially in a case-by-case argument, case-by-case basis, an argument for making certain choices depending on your own exposure and whether or not you prioritize getting COVID versus succumbing to the worst effects of COVID. So what do you make of all of this? What should we read into the Cleveland Clinic study?
Okay. So, and again, I think I'm very much a centrist here, which was that my point of view throughout COVID was in January of 2021, when the vaccine was available, if you are an old person, have underlying medical problems, you should run to get the shot because it will lower your risk of severe disease and death if you have not had COVID. For people who've had COVID, I thought we should have made the manufacturer do a special study just in them. We never did that. They had plenty of money. They could have done that study. I suspect that study would have been negative because having had and recovered from COVID was pretty good protection against getting really sick from COVID again. So I suspect it would have been negative. I thought that around young people and children, I thought maybe you could make it available, but don't put the squeeze on them. That was kind of my view. Let people choose. Now, I think there have been some FOIA emails from Walensky where she talked about breakthrough infections even in first quarter of 2021. So she knew the vaccine couldn't stop infection in the FOIA emails. By the summer, we had Provincetown, Massachusetts, where we were pretty confident that even if you get vaccinated, yes, there may be a reduction in severe disease and death, but you're very likely to get a breakthrough infection anyway. And then when Omicron came...
But just because there are some breakthrough infections doesn't mean it's not having an effect on transmission, right? Some effect. So I thought that the first wave of COVID actually...
was dampened.
Yes.
And I think it was. But I mean, Briahna, the way I would say is take the long horizon. Over a horizon of 10 years, the probability you get COVID is 100%. Over a horizon of 40 years, the probability you get COVID 5 times is 100%. And so what I'm saying is, so I will agree. I suspect it did dampen transmission significantly first quarter 2021 until there were true escape variants like Omicron, where it no longer probably didn't even dampen transmission. But dampening transmission when it's just going to blow through anyway, and you're not going to be any younger or healthier, in the future, that to me is like not really a great benefit. So back to the RFK point. I personally, having looked at all of the studies on this question of whether or not it actually increases the risk of getting COVID, I'm not, even as a skeptic, I'm not sold that it increases your risk of getting COVID. Some people might call that antibody-mediated enhancement, or you're more likely to get COVID if you get the shot. I'm not convinced of that. I think the truth is, and this is already the case for most of us, we've already had COVID. I mean, I think the CDC says the last they kept count was 96% of children under 18 had COVID. So it's going to have 100% penetrance. And then the longer we live on this planet, we're going to get it every few years. So to RFK's point, and to the broader point you're asking, which is, should this be mandated? Should we have to get a yearly shot? I'm very skeptical. I personally have said I'm not going to do it until people show me good evidence. I'm going to assume I'm going to get COVID again. I've had COVID once. I've had 3 doses and a COVID. I'm sure I'm going to get another COVID in a few years. And I'm going to get a lot of other things along the way. I don't think the vaccine made me more likely to get COVID, but I'm pretty sure it didn't prevent me from getting COVID because I got COVID.
Why are you skeptical?
Yes, why am I skeptical?
Why are you skeptical of the negative efficacy point?
Probably because that these are not randomized data. So the differences between the two groups that could cause negative efficacy are also that they behave slightly differently. So the people who may get it may be doing things slightly differently, like going out more and maybe even more likely to test or more likely to report. Like it's not, these are not the same group of people who do it and people who don't do it. People who do more.
Isn't there some argument that's made about what the causal factor is from a virology perspective, that there's something about having having the weakened version of the virus that makes you susceptible? I feel like there was like a medical explanation that was offered up. I mean, not proven, obviously.
Yes,
but the study contemplated whether it was a behavioral change, and they offered up that there could be this, I don't know what you call it, epidemiological reason. I don't know.
Yeah, and biological reason.
Yeah, sure.
Your point is that, is it possible that somebody makes a vaccine that actually makes you more likely to get something? Absolutely. In fact, I think we had a failed HIV vaccine, New England Journal paper, would actually increase the risk of getting HIV. This is a known phenomenon. A vaccine can make you more likely to get it. I'm just particularly skeptical about this unique study, but there is this principle in place that is possible. And so, they didn't prove to me that it's one or the other. Mm-hmm. And to be honest, Briahna, I mean, to me, even if you're 3% or whatever percent more likely to get it, you have a 100% chance of getting it. So I mean,
but it wasn't 3%. It was 3.5 times more likely.
3.5 times. Okay, so it's a high. but again, I think you're 100%. Like, I assume you've had COVID. I've had COVID.
I did once.
Okay, I've had it once. I'm not sure I know anyone who hasn't had it anymore. So we're all going to get.
I will say, my mother and stepfather, who've been both working from home, and now my stepfather's retired, and my brother, they're all living in the same house in Cleveland, and none of them have gotten it yet. So that's just who I know in my life.
Check their antibodies. But no, okay, good. I wish them well.
I'm not saying they never will, but I am saying that I do know people who haven't gotten it yet. And they have very specific kinds of lives. There's no small children around. They don't go into an office. Everybody can't live like that.
Yes.
But they're also looser about masking. My mother does, travel for work and engage with people for work. And, she's exposed. She's not living in a bubble boy bubble, but still hasn't gotten it. Yeah.
Yeah, I guess good for her. But I mean, I assume that she will get it at some point. I mean, it's only a matter of time.
I assume that as well.
And I assume it's going to be like a cold. I mean, and if you didn't tell her it was COVID, you wouldn't even know it was COVID, honestly.
Yeah. I mean, so this brings us to another point that actually is related to my mother, because from the beginning, she's been like, well, here's a big box of vitamin D she mailed to my house, and I've been religiously taking my vitamin D supplements throughout. RFK has said in an interview that we should have focused on medications that worked, as opposed to focusing on the lockdowns. He says it would have been better, more effective to give people vitamin D than do lockdowns. And there's been a lot of debate around the vitamin D question, I think in part because people feel as though that is an either or, that if you say that there is some evidence of the protective effect of vitamin D against hospitalization and death, then that is going to be using it as an excuse not to vaccinate, as opposed to layering those things. So what do you make of the vitamin D question?
I guess it's part of my broader philosophy of medicine, okay, which is it's hard to make a healthy person better off. So what do I mean by that? First, about the lockdowns, I agree with him. That probably was a mistake for lots of reasons, for scientific reasons, for humanitarian reasons, for public health reasons, for ethical reasons. I think that was probably a mistake. Now, what about vitamin D? He also likes other things, ivermectin, hydroxychloroquine.
Right.
And
he did say that.
He did say those things. Now, let's talk about the things I'll give him credit for. If he wants to say, should people be allowed to go outside and get some sunshine and exercise and lose weight and, stay fit? And might that make you better off in the long run? He gets my full support. I am generally a skeptic of all supplements and vitamins for healthy people. I'll say COVID, no COVID. I'm generally a skeptic. Why am I a skeptic? I think vitamin D has probably 60 or 70 randomized controlled trials in healthy populations. It's not the only, it's the vitamin that's in vogue in 2023. But I've been around long enough to know that beta carotene was in vogue in 98 and selenium was in vogue. And, different vitamins have different heydays. Vitamin C was in vogue in the 1950s and 60s.
Well, the vitamin D and the vitamin C have a relationship, right? Vitamin D is for vitamin C absorption. This is an immune issue. And the argument is, one, that there has been this correlation between people who are hospitalized from COVID and die from COVID and low vitamin D levels. And the argument is that disproportionately Black people, darker skinned people have borne the brunt of this disease. And we do tend to have lower vitamin D levels because vitamin D is synthesized in the skin with the sunlight. And we have more melanin that prevents the sunlight from being able to get through. So, this doesn't seem irrational. It's not that it's a silver bullet, but if you see the people who are getting sick have low vitamin D levels, it's not going to help people who already have high vitamin D levels or adequate vitamin D levels. But why not recommend it to people who, especially in populations who tend to have lower vitamin D levels, like Black people?
I guess I would say my compromise position would be, should it have been studied? Yes. I think it has been studied.
It has been studied. And people will pull whatever study they think is advantageous, but there's been lots of studies that suggest that it has this protective, beneficial effect, I should say, for COVID specifically. So my understanding was that it doesn't help you if it's administered in the hospital when you're sick. And I've seen people challenge me with studies that show that giving it to hospitalized patients has no effect on outcomes. Obviously, because that's not the point of it. The whole point of it is so that your immune system is healthy going in, not like you can supercharge it just with a couple of pills while you're in the hospital, right? But the other studies point to the fact of having good vitamin D levels prior to contracting COVID is correlated with better outcomes.
You're probably correct that these correlations exist because people with lower vitamin D often have lots of other things going on, like other medical problems, et cetera. It's not like a random thing. Now, in terms of supplementation, okay, this is a nice study. It looks like CoronaVit. We randomly assigned 6,000 UK adults to receive a postal finger prick, vitamin D, and a provision of a 6-month supply of a high-dose vitamin D or lower-dose vitamin D to those with blood concentrations less than 75 nanomoles per liter, or no offer of supplementation, 3,000. The primary outcome was the proportion of people who had any acute respiratory infection and those who had swab-tested COVID-19. And then they find, basically, no difference. Among adults with a high baseline prevalence of vitamin D insufficiency, implementation of a test-and-treat approach to vitamin D replacement did not reduce the risk of all-cause respiratory infections or COVID-19. So it's kind of similar to your point. I guess my point is not that I don't think anyone's crazy to think it, and I don't waste much of my time in clinic talking people out of taking vitamins. In fact, I say, if you want to do it, you do it. I guess I would say probably the reason people don't endorse it is those kinds of studies don't show benefit. If they did, I think more people would endorse it. But one more point he makes, he says that the reason they don't want you to have these drugs is that they wouldn't be able to give the EUA for the vaccine. That's one of his claims. Mm-hmm. And
the emergency use. So his argument, just for people who don't know, is that to get the emergency authorization to approve the vaccine quickly, you can't do that if there's already an effective treatment on the market. And so there was this effort to discredit existing effective treatments that might include vitamin D, ivermectin, zithromax, and hydrochloroquine. Those are the ones he named. And you're saying in response to that,
I guess my response to that is I'm so cynical that even if any of those things worked, they could still use EUA and ram it through, like they don't care, and proof of that is they had remdesivir, they had dexamethasone, they did have some drugs that they conceded worked. Remdesivir was pushed by Fauci, and yet they still pushed for the vaccine. So I guess to me, like, I don't think it would have precluded them from pushing for the vaccine.
So it's not the study that I sent you is not conclusive, right? Its conclusion is that current evidence supports the benefits of vitamin D interventions in patients hospitalized with COVID due to the protective effect provided by vitamin D against ICU admission and mortality. It needs more research. It needs more study, but it's potentially there. That's it. So what do you make of the study? This one, by the way, for people who
meta-analysis,
it's a meta-analysis in from 2023, protective effect of vitamin D supplementation on COVID-19 related intensive care hospitalization and mortality. Okay. Shoot. Hit me.
What do I make of it, Briahna? I'd say, yes, it is a meta-analysis of randomized trials that does show a signal that's worthy of exploration. The part that I don't have a good sense of is how do they pick these 5 studies and not the other studies? And look, it's intrigued me so much that I'm tempted to do it myself. I'll do my own meta-analysis on this question because my intuition tells me that it's going to, be closer to null. But look, if your point is, would you be crazy to think it has some effect? No. I mean, yeah, you have a meta-analysis. I won't say nice yet. I haven't read it so closely, but you have a meta-analysis of randomized trials that shows, it looks promising. Okay, I'll give you it. But I'm skeptical.
I haven't gotten sick from hardly anything the entire time COVID has been happening. And I partially attribute that to my consistent vitamin D usage. And when I did get COVID, it was after I had traveled internationally for over a week and I had forgotten to pack my vitamin D pills and I was not taking them. Anecdotally. But
you're also a healthy and vibrant person. So, okay, I'll take your anecdote. Okay.
All right. Okay, we're at the end here. You've been very patient. I know we've covered a lot of ground and I've hit you probably with more detail with this stuff than you were maybe anticipating. The last argument that he makes, and it's related to this point about the efficacy of lockdowns versus ivermectin, zithromax, hydrochloroquine. He says that those, first off, those medications were effective for treating COVID. Where do you stand on those 3? Ivermectin, zithromax, which as I understand it is an antibiotic, and so I don't really understand what the deal is with treating a virus, and hydrochloroquine.
Yeah. I think the antibiotic, some of the thought was that people would have secondary bacterial infections, but some of the thought was it has some properties that may be sort of anti-inflammatory independent of bacteria. I personally think that the totality of the randomized evidence is negative on all those things. There's an old quote by William Osler, which says that the thing that separates man from the other animals is the desire to take medicine. And as a doctor who's been doing like meta-analysis for a long time, my personal view is that some medicines work, they are very few, and their effects are more modest than we would think. And when you have something entirely new, your baseline probability has got to be that medicines are probably not going to work, and they're probably not going to work well. Antivirals as a class of medicines in general, with the exception of HIV/AIDS, they often aren't great, like our CMV drugs aren't great, our EBV drugs aren't great. So I'm skeptical entering. I pull all the randomized data on hydroxychloroquine. This was nicely done by Catherine Axe-Fors at Stanford. It shows no survival benefit. The same for ivermectin. What RFK Jr. likes to do is he likes to say that some of the big studies gave too high a dose. It wasn't given the way he would have wanted to give it. And so you should exclude those and look at the other ones. You can always come to a literature after it's done and say, I don't like these studies for some reason. I believe the burden of the proof is to the person who believes it works to get the right dose and run the right study and convince other people. I know he couches it in the broader question of like that if you had these drugs, you wouldn't have had the vaccine. I just flatly reject that. I just reject that. One could argue that how did we get an emergency use authorization in 6-year-olds? Because the risk to a 6-year-old is pretty low. It's like, 7,000 times lower than an 80-year-old. And yet we still used the emergency use powers, which is extremely powerful regulatory. And I question whether or not it should even been used. Okay. So I think that there was a huge political interest in getting this manufactured, the entire market share. So if people who think that this works, if they'd granted the EUA, if they had allowed hydroxychloroquine ivermectin on the market to be marketed for this purpose, they would have still had the vaccine. I don't think it would have stopped the vaccine. The last thing I'd say, the thing I'm sympathetic to him about, those two particular drugs are not the only two drugs that didn't work. There's like 20 drugs that didn't work, but we always talk about these two, and these two were particularly demonized. One, of course, Trump famously said you should take it. And so we who don't like Trump on the left, we thought it was the worst drug. And ivermectin was also promoted by sort of right-wing people. And so these two drugs have really been politicized. So it's lamentable. There are lots of drugs that didn't work for COVID. There are a few that did work.
Right. And the horse tranquilizer smear that even
terrible.
Yeah, they had to walk back.
Joe Rogan.
Gupta had to walk back on Rogan, exactly, because there's human ivermectin. You don't have to make it a weird veterinary scandal to say that it doesn't work for.
And the developer
COVID.
Did win the Nobel Prize, and it is a potent anti-helminth, and it has improved lives for many people. It just probably doesn't work for COVID.
Yeah. Okay, and then the last thing, you're so patient with me. The last thing is this claim that Nigeria, for example, had a 1.3% vaccination rate and only had 14 deaths per million, and that we had 3,000 deaths per million with a much higher, whatever it was, 80+% vaccination rate. And that is proof of the inefficacy of our approach to this. What do you say to that?
I mean, I guess I hate all the country by country comparisons for lots of reasons. One is that some countries are not even reporting the deaths accurately. I don't think I trust a single COVID death statistic from China.
Sure.
Some countries are not testing the same. We had a policy in the United States where every single person hospitalized is going to get swabbed on entry. Other countries aren't doing that. And so if you test more, you will attribute more deaths to COVID-19. The way we catalog the deaths and code the deaths and score the deaths and report the deaths is different country by country. So I already take that with a grain of salt. The next thing is lots of things impact COVID-19 mortality. One is, of course, the use of these particular products. The other is, what's the age structure of the population? How many people under 30, over 30? What's the health of the population? What's the fitness of the population? How many comorbidities of the population? And so to me, it's very messy to look at the US and Nigeria pretty much on any indice and try to say one thing is the reason why it's different, because there's probably a lot of things. So I kind of reject that whole line of argument.
Yeah, I think that makes a lot of sense. Dr. Prasad, you came out strong, and as did I, in favor of Dr. Hortez having a conversation. I don't know if it has to be a quote unquote debate, but having a conversation with RFK Jr. And I strongly feel that because there is some credibility going through a lot of these claims, or at least there's some cause for skepticism from a normal thinking person who's not a conspiracy nut job and who is fully vaccinated and all of the things, that the only way to regain that credibility is to go head to head with these ideas. And I really do appreciate your willingness to do that with me tonight. I wonder what you think, as just a final question, what would happen if Dr. Hortez sat down with RFK Jr.? Are you concerned that, frankly, he's kind of overreached and the claims the claims from the quote unquote medical establishment have been so kind of more than they can prove, or expressing more confidence than really exists in science, that he has a legitimate concern about just frankly losing to RFK Jr. and like losing face at this point?
It's a good question. And I think, yes, a legitimate scientist who's in the establishment, who holds a lot of the establishment viewpoints, should have a dialogue with RFK Jr. I don't think it should be Peter Hotez. I think Paul Offit would be better. I actually think it would be better if you have a bunch of doctors who have slightly different shades of gray point of view and we get a round table. I think that would be better. The reason Peter Hotez, I think, wouldn't be terrific is that I think RFK is going to mop the floor with him for some of his past views, particularly on school closure, on mandating the COVID vaccine to children. So to your point, an establishment figure who got a lot of COVID policy wrong is not going to go well in the eye of, the Joe Rogan audience, the supporter. And I really think that the way to engage with RFK is the way you're doing, actually, and the way I'm trying to do, which is not to insult him and to give credence to what his root concerns are, which is really the concern of the corrupting influence of money. That's his root concern. How can I trust this system? It's so corrupt with money that how can I trust that these vaccines are really best for my children? And if there was a safety signal, you wouldn't tell me anyway, would you? And that root concern is a real concern that we on the progressive left have never, we need to address that concern. Stop revolving door politics, improve FDA, have some impartiality of the agencies. And then I think we can come back to him with better studies and say, look, these particular concerns were not valid, but we found out this other drug out here on the market was doing a lot of harm. And thank you. We'll stop that one.
Yeah,
that's what I think will happen.
Oh, well, thank you so much for your patience, Dr. Prasad. This has been so helpful to me. I have been kind of putting off combing through this stuff with a fine-tooth comb because it is a lot and it is daunting. And as someone who was a history of science major but does not have any real hard science experience, it's a lot to get through. So I really do appreciate you being an expert who is unafraid to actually just confront the evidence head on. Can you let the listeners know where they can find you, the article that you wrote going through some of this stuff, and anything else you're doing on the internet these days?
So I'm a professor here at University of California, San Francisco. I'm an epidemiologist and oncologist, and you can find me on Substack at Vinay Prasad's Observations and Thoughts. I also write for Barry Weiss for the Free Press. I have a podcast called Plenary Session, and so you can check that out.
Terrific. And thank you all for listening. If you found this episode as valuable as I did, please don't forget to like this video and share it on social media, subscribe to the Bad Faith YouTube channel. And if you want to support independent media efforts like this one, you can subscribe to Bad Faith Podcast at patreon.com/Bad Faith Podcast and get a full additional episode every week on Monday, in addition to this free Thursday episode. Help support independent media and my ability to keep putting out free content like this every single week. Thanks for listening. And as always, keep the faith. Hey YouTube, thanks for watching. Just a reminder that this is a podcast. You can catch an extra premium episode every Monday for $5 a month at patreon.com/Bad Faith Podcast. That's patreon.com/Bad Faith Podcast for $5 a month, an extra episode every week. Additionally, please do consider liking this video, subscribing to this channel. It helps us out. It helps independent media beat the algorithm. We appreciate you. And as always, keep the faith.